Ready? Okay.
Good afternoon. Did you start it? Good afternoon. As you know, my name is Carol, and I am today I'm going to be doing a PowerPoint presentation to help review the amount, to help prepare some of you for the CNF exam that's coming up. The information that will be given, will not be completely new to some of you, because a lot of us have been in Reno for maybe, some of us have been here for 5 to 20 years. So the information is information that is more a review than new to a lot of us. So I basically want to focus only on the bone osteophy, and in order to prepare you for the exam and give you a refresher. And because we all have different learning styles and needs, I have put together the PowerPoint presentation in order to appeal to the various different learning styles that we're all used to. Okay? And so now, for those of you that like to have hands-on, I will have, at the end of this presentation, I will be having a few questions so that everybody can get a chance to see just how much you have picked up from the information that I will be giving you. And also to help you to satisfy your learning needs. Okay? So the PowerPoint will help. You will see the auditory and the visual learning style that is out there available. And so as we move on, the objectives are, we're reviewing the specific points to help prepare nurses for the CNF examination. And upon completion of this presentation, each of you nurses will be enlightened awareness of the renal osteophy. Nurses will be able to identify patient abnormal lab values. Nurses will be aware of nursing interventions and medication to treat renal osteophy. Nurses will demonstrate a clear understanding of renal osteophy by engaging in some sample questions. Now, let's just focus a little bit more now on what is a normal function of the kidney in relationship to bone metabolism. As we already know, the kidneys stimulate and regulate active vitamin D, involved in regulating calcium, phosphorus, and parathyroid hormones levels. And I have, as you can see in this PowerPoint, we can see that the kidney and vitamin D, you have the UV ray that is helped to stimulate vitamin D that's formed in the skin during the exposure to sunlight. So as you're getting your sunlight, you're forming vitamin D. And then from there, the vitamin D is then processed by the kidney to influence the parathyroid hormone, which activates vitamin D and turns it into calcitrol. And we know that calcitrol helps the body absorb calcium. So with the calcitrol helps to promote calcium and phosphorus absorption from the intestinal tract. It also promotes the incorporation of the minerals in the bone. And calcitrol helps maintain normal parathyroid hormone, PTH. With our patients having kidney failure, the kidney stops converting the vitamin D to calcitrol. And there is also an inability to excrete phosphorus, and this phosphorus is accumulated in the body. The body is then unable to absorb the calcium from the intestinal tract, and it borrows the calcium it needs from the greatest calcium storage depot, which is the bone, which is in deposit into the bones. And this decreased formation of active vitamin D in chronic renal failure can lead to osteomyelitis. I can never say that word. I'm so sorry. I can never say. And you can see it's with that deficiency in our calcium, it causes the bones to be easily broken. Now, this just shows us the breakdown of the how the normal bone is using the calcium. The first picture up here shows you how it's broken down within the normal bone, and then the second picture shows you what happens when you have the problem with the calcium deficiency or bone deficiency. Okay, so renal osteophyte, it's a syndrome of skeletal changes and failure of normal development in normal bone due to abnormal calcium and phosphorus metabolism. And it's characterized by hypercalcemia and hypocalcemia and impaired synthesis of renal vitamin D with reduction in serum calcium levels. So, in other words, renal osteodystrophy represents a common disorder in patients with chronic renal failure. And just touching a little bit on the pathophysiology. In a person with chronic renal failure, the kidneys are increasingly unable to activate vitamin D, and it excretes the phosphate, resulting in your decrease in your calcitrol, increase in your phosphorus, and decrease in the calcium. With this my PowerPoint is not working well. The PTS help to increase serum calcium level by drawing the calcium from the bone. And this again is another picture that's just kind of illustrate what the mechanism of what the chronic renal failure does with bone distribution. And again, the pathophysiology continues with the constant hypocalcemia, which causes an overactivation of the parathyroid glands, causing them to secrete increased amount of PTH. This includes hyperplasia of the parathyroid, and this condition is called secondary hyperparathyroidism, and it causes significant bone damage. And some of the signs and symptoms that we will see in our patients are long-term symptoms such as bone pains, and we've had a lot of our patients with that. Bone disformities, increased risk of fractures, and of course, you guys are all aware that we've had quite a numerous amount of our patients that have had a lot of breaks by simply hitting themselves against any object, and they come in and said they have a broken fracture or fractured limb. So we are aware of, we have seen these, the bone deformities, and we've also seen the fact that they break their joints very easily. Okay, and so some of the treatment that we are using right now, the goal of the treatment is to restore the balance between the calcium, the phosphorus, and the parathyroid hormone and vitamin D in the body. And therefore, we're keeping the serum level at 2.12 to 2.62 millimole per liter. Calcium carbonate and calcium lactate, calcitrol, adjusted dialysate calcium, the amount of calcium within the dialysate, and then vitamin D supplement to enhance intestinal absorptions. Now, some of the complications that we will encounter are elevated PTH may have a suppressive effects on the bone marrow and erythropoiesis, such as anemia. And excessive PTH can promote the formation of calcium deposits in the walls of the blood vessels and valves of the heart. Calcification of the coronary arteries may contribute to the risk of serious cardiac events. Some of our responsibility as nurses are to monitor the patients for bone, joints, or muscle pain, and monitor their serum calcium levels, and provide educations for them, such as allowing them to see what is normal and what is abnormal, and making sure that they are taking their medications that is ordered for them, and the diet reduction of dietary phosphorus and protein, and a lot of self-observation skills. Now, we are supposed to ensure to evaluate the comprehension. Now we'll move into our sample questions. Before we go into the sample questions, are there any questions that you would like to me to explain a little bit more? I mean, like, I ran through that PowerPoint very quickly, so if there's anything that you would like me to explain, please let me know right now. Okay, yeah, that's a good question. Yeah, okay. So we're going to ensure that our patient is fully informed, and make sure that they are able to know when they're taking their calciums, and that they are taking it on time. Any other questions? Okay, let's go and let's see just how much you've absorbed from my brief presentation, my PowerPoint. What are the benefits of Renagel versus aluminum hydroxide? I don't think I went that deeply in it, but I'm sure you all are aware of what Renagel versus aluminum hydroxide is. Okay, can anybody tell me what that answer would be? Oh yes, that's right. No aluminum oxide, because it causes weak bones. It also binds the cholesterol. The next question. What stimulates the kidney to act on the bone in conjunction with calcitrol? Yes, it is. That it is. Parathyroid hormone. Thank you. Now, I think this is our last question. What is the end result of conversion of vitamin D by the kidney? Thinking about it. Okay. Yes, that's close enough. Yeah. It's the 125 hydroxide vitamin D3 calcitrol. And that's all the questions that we have for today. Now, I'm hoping that when you go to your exam, that when you see anything related to the bone disease, you might remember something from what I've presented to you today. So I wish you all the best for your exam, and I'm hoping that everybody is able to pass that CNF once more. Okay? Thank you very much for your attention, and bye for now.